I want to address reporting related to conversations of discussions at internal Emergency Operations Centre meetings. I am profoundly disappointed that confidential internal conversations have been shared, actions that are a violation of the Public Service Oath and Code of Conduct. This is a personal betrayal and a betrayal of the trust that our hardworking team has placed in each other. For months, I have worked alongside a team that has been dedicated to supporting Albertans in responding to COVID-19. The team has been committed to providing evidence to inform policy decisions. They have spent time away from their families to do this work and provide their best advice. The comments, as reported, are taken out of context, separated from the many other discussions that would have occurred in the days before and after, as part of ongoing discussions to ensure that my advice to the Premier and to the Minister of Health is grounded in evidence and considers every facet of potential discussions with elected leaders. This process has been violated. These meetings should be a safe space where public servants have candid and ongoing conversations and debates. This safety and trust are now broken. I have been clear that my role as Chief Medical Officer of Health is set out in legislation. My role is to provide the best advice possible to elected officials on how to protect the public health of all Albertans. I take that responsibility seriously. I care deeply about the health of Albertans.
Since the pandemic began, as Minister of Health, I have worked closely with Dr. Hinshaw. She has provided detailed, evidence-based recommendations to me and to Alberta's government as legislated in the Public Health Act. She has also participated in ongoing cabinet discussions about what is right for Alberta in the response to this pandemic. We listen closely. We debate the range of policy options that she offers and their different impacts. And then as elected officials, we do what we were elected to do. We make decisions that are in the best interests of Albertans. I want to express my own and Alberta's government's support for Dr. Hinshaw. She's one of the finest medical officers of health in the country and has worked tirelessly for months to protect Albertans. The story this morning concerned me for one reason only, that it violated Dr. Hinshaw's confidence and it embarrassed her. I called Dr. Hinshaw this morning to tell her that she has nothing to apologize for and that she has my complete confidence.
I do not know who made the recordings and who spoke to CBC. There will be an investigation to determine who has done this because, as I said, this has serious repercussions and is a violation of the oath that all of us have taken. My professional integrity is incredibly important to me, and when I've taken an oath that indicates that I will provide the recommendations to elected officials in confidence, it would be inappropriate for me and a violation of my professional integrity to break that. I believe that Albertans understand that I provide those recommendations in their best interest. And again, it is the individuals that Albertans have elected, trusting them with the responsibility of making those weighty decisions on their behalf. And so Albertans have placed their trust in those officials to take my recommendations along with all other considerations and to make the best decisions possible.